So the prognosis for lung cancer is actually moving absolutely in the right direction. This still is a very challenging disease, and unfortunately still there are patients who don't have as good of a prognosis. But for the vast majority of patients, given the new treatment options that we have, their prognosis has significantly improved.
I define advanced lung cancer as cancer that you cannot take to surgery. So something that started in the lung and now it's in your bones or it's in other parts of your body in multiple areas.
How have treatments for late-stage lung cancer evolved?
We used to treat with chemotherapy only. Over the last 10 years, we discovered that non-small cell lung cancer have mutations, different mutations, and we can call them weaknesses. And we learned how to target those weaknesses. The second major discovery was discovery of immunotherapy.
Can you explain to us what exactly is immunotherapy?
Immunotherapy is one of the most dramatic changes in all cancer care in the past 5 to 10 years and has really revolutionized the space in lung cancer.
When you diagnose someone with advanced lung cancer, what is that conversation typically like?
Each patient approaches their care differently and has different goals, expectations, concerns. So first, I kind of make sure that I go over all the information so I really understand what's going on. I ask the patient what their understanding of the situation is, and then really talking to them as much in English as I can instead of medical mumbo jumbo, what's going on with their disease, what this means for their health, what their treatment options are.
You know, it was interesting. I had a buddy of mine who, when we were residents, had colon cancer. And he explained to me, he said, we see these statistics, we get it as doctors. He goes, but when I was a patient, the only thing that gave me comfort was that when I saw a patient next to me that was my similar age, same cancer, and he was still doing fine 5-10 years later, he said that gave me more hope than any statistics that we read in the medical books. So that always stuck with me.
Do you have a patient success story that you could share with us?
Every time I hear that the patients are enjoying vacations, they are able to participate on family events and create memory, that's a success story for me.
What do you think the future looks like when we look at cancer treatment?
I think the future for lung cancer particularly is really, really bright.
I'm extremely optimistic, but I have to stress the real cure early on is to get that cancer as early as possible. There's a lot of room for hope. Having a lung cancer diagnosis is not a death sentence.